Okay, so good afternoon, everybody. While we wait for everybody to log in, I'm going to launch a poll. We like to know a little bit more about each person that's here in the webinar this afternoon. So I'm launching a poll with 4 questions. If you could please take a moment to answer these questions, and we'll get started with the presentations right after this. So the first question is asking how many employees are in your company. Um, answer to the best of your ability. Do you have any experience human resources person at your company? Does your company have a safety manager, director, safety coordinator, or no safety manager, director, coordinator? And how familiar are you with HIPAA rules? So we'll give everybody, while they log in, um, to answer these 4 questions before we get started. Okay, so good afternoon to everybody who just recently logged in. Um, I just recently launched the poll. If we could take about less than a minute to answer these 4 questions, we like to get a better feel of what type of um, audience we have today. Okay, so I'm going to read the questions one more time and we'll get started. The first question is, how many employees do you currently have at your company? Second question, do you have an experienced human resources person at your company? Does your company have a safety manager, coordinator, or no safety manager, coordinator? And how familiar are you with HIPAA rules? So I'm going to end the poll and we'll share the results. If everybody can see the results, so it looks like the majority of the attendees have more than 30 attendees. Have more than 30 employees at their company. And the majority do have an HR person at your company. And we have the majority of the audience has somebody that's either a manager, safety manager, or coordinator. And we do have a few that do not have a safety manager, coordinator, or director. And then the majority of the people of the audience is somewhat familiar with the HIPAA rules. So I want to thank everybody for logging in today. I know this information came out not too long ago. And I also want to thank Manny and Luciano and Yolanda for helping me put this together. So I just wanted to go over some quick housekeeping rules, just to remind the panelists to keep themselves muted until it's your turn to talk. The webinar is being recorded, and then we will have one more poll that will be launched. And if you get logged out, just use the same link that you've used before. And then any questions you have, please ask them through the Q&A button, the portal. Don't put them in the chat. Put them through the Q&A portal. And we'll be answering those throughout the webinar. So make sure you, again, you ask your questions through the Q&A portal. So the first thing we're going to cover today is, what is HIPAA? HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. This was enacted on August 21st, 1996 by the U.S. Department of Health and Human Services. So this is something that went through Congress a little over 20 years ago. And the biggest thing about what we're going to cover with HIPAA is, now that we're dealing with health information of employees, we want to make sure that everybody's aware that there are rules behind that. Very similar. The closest example I can give you is just in like in accounting, when you're receiving money and you're paying things. Um, I can give you an example with the IRS. What is a business expense versus what is not a business expense? Um, the IRS will come out and audit you based on, you know, your tax returns and how you're stating things. So we want to make sure that you're aware about these HIPAA rules. There is something in place that protects the information of employees, and we're just going to do a very big overview on HIPAA, and then towards the end we'll ask a few more questions on in regards to this topic. So moving forward, these are the topics that we're going to cover today. How not to violate these rules, and to know that there is a you can be financially penalized, and record keeping according to HIPAA rules. And this third bullet, we want to make sure that as you're gathering information on the health of each employee, that you are in contact with an experienced attorney on how you're supposed to be keeping this information. And also, if you do have an HR department, um, you know, if you have multiple offices throughout the Metroplex or the state, you want to make sure you contact your HR department and know how you're supposed to keep this information confidential. If you do have offices throughout the US, um, there probably is different rules for each state. So make sure that you are very well aware of what those rules are so you're compliant. So this next slide covers the civil penalties. This is information straight from the website for the Health and Human Services. So there is, this gives you the breakdown on what the penalties can be. So again, we want to make sure that you are aware that there can be penalties. And then again, get in touch with an attorney or with your HR department to know how you're supposed to be keeping record of some of the information that you're taking of the employees. And we know that each day, each week, each month, um, since we've taken this drastic change due to COVID, there are going to be rules and regulations that'll be amended, changed, or added on. So just be aware and be on the lookout for that. And we will try to put out the information on any changes or anything we see that is important. We'll put that out. The next slide talks about what information is protected. So I'm gonna just read it real quick, but the protected health information, the privacy rule protects all individual identifiable health information held or transmitted by a covered entity or its business associate in any form or media, whether electronic, paper, or oral. The privacy rule calls this information protected health information. Individually identifiable health information is information, including demographic data that relates to the individual's past, present, or future physical or mental health or condition, the provision of health care to the individual, or the past, present, or future payment for the provision of health care to the individual. And that identifies the individual or for which there is a reasonable basis to believe it can be used to identify the individual. Individually identified health information includes many common identifiers, e.g. name, address, birth, date, social security number. So this link below takes you directly to the Health and Human Services website and what it covers with HIPAA rules. This information, again, we want everybody to be aware that there are rules out there behind the privacy of information on the health of each individual employee. and we want to make sure that you are reaching out to your HR department if you have one, and if not, with an attorney. So we're making sure that you're not going to get fined if there's some type of audit. So up next, I want to introduce Mr. Luciano Perez, who's our Safety Council Chair here with the RHCA. Luciano is going to give you more information on what happens if somebody tests positive, and then some more information on procedures to put in place. And Luciano, if you don't mind introducing yourself.
Yes, yes, Julio, thank you. Thank you for the invitation to participate in this webinar. I work for a company, as you mentioned, or is on the screen, Capos Roofing and Waterproofing here in Dallas, and I'm a safety manager, oversee all the safety and health for the company. And when I have extra time, I help Julio and the Regional Hispanic Contractor Association through webinars or classes when we can, and we've just been working together for the last 8 to 10 years. So the first thing that we are going to talk is, what should an employer do when an employee tests COVID-19 positive? And this is based on experience and what I'm seeing in the field. Any company can make or have different protocols to follow, and for the most part, I think we are on the same page as far as the 14 days. That's a minimum, the 14 days period of time if an employee tests COVID-19 positive. So automatically that employee stays at home for those period of time, for 14 days as minimum. And those are the guidelines that I found in the CDC guidelines. Those basically, if you no longer have a fever after those 14 days or so, and it is important, it is highlighted, without the use of medicine that reduces fevers. So you not need to be taking ibuprofen or any other medicine. You should be ready to go on your own with your immune system. Other symptoms have improved. For example, the cough or shortness of breath, you don't have any of those. And the other one, that you may receive 2 negative tests in a row, at least 24 hours apart. And then we will require a doctor, some proof of documentation, so before you return to work. And that's, and I think at the beginning, Julio, you mentioned the word HR. So we have a very, very strong HR department, and this is not my expertise. As far as I contact the HR personnel. They know more. And if you don't have the HR department, then many companies don't have, or small companies, a person, an officer, a leader of the company, owner, should contact or make a phone call with someone that knows more in this, what to do with the employee. As far as Julio, you were talking about the HIPAA, privacy of the employee, and you just contact, make a phone call. And I make phone calls throughout the week to people that know more than me in certain areas. I call OSHA, for instance. So the key in this area is to know what to do, and if you don't know, make a phone call to the people that know more in this area. The employee, I've seen people, if the employee is positive, all the people or the co-workers that were interacting with this particular employee are being sent home and do a test also. Some company pays for those tests and the days that the employee are at home, and some companies don't. So it depends. It depends how you gonna internally, your company, how you treat this in this case. So that's what I what I see that's going on right now with an employee that tests COVID-19 positive. There is a lot of information also in the CDC, a lot of, I just print, or we print last week, I think, or before, some flyers also in Spanish and English for in the kitchen, to post on the kitchen and areas. That way that, you know, that way the people can see, read some of the information that we have available. So the next one is develop policies and procedures to protect the privacy of your employees. So this is something that you don't have to have like a book of 20 pages, but something that the officers of the company develop with again, I go back on the HR department. If you have one, that's the key personnel that must be implementing this. And if you don't, well, the owner or vice president, somebody with knowledge of policies and procedures. In our case, the leaders of our company, the officers, they communicate with us via email. And because we are more than 300 employees, and so via email, and then it is transmitted also in Spanish, not just in English, but it is translated and transmitted in the Spanish, which is the third point that is emphasized there, in the language that your employees can understand. So if you communicate in English only, and you just communicating that info to a percentage of the company, and not the other people that may be working for you. So the other one is the post flyers. If you don't have an email or post on the doors or in the kitchen, and so what is the procedure? What is the policy going on from now on? What is the policy now that we're returning back to the lifting some shelter in place, and we're returning back to work to the essential business? Is a procedure. What is the policy? What is the procedure? And we internally, it was communicated to us via email and with the procedure. What is the procedure? I know other companies that the people feel, especially feel, they don't know. They don't know. They just there's no communication on all this. If it's a small company, for instance, whole day meeting. If it's a small company, 15, 20 employees, hold a meeting. That's another way to communicate what is the policy or procedure. And we emphasize the bullet point at the bottom, which is when in doubt, call your HR manager. Very, very important, or director, or company leader, officer, owner, but you make that phone call and be proactive in a sense of if you don't know what to do, you just make a phone call and say, I have a case, this person is 100.4 the temperature, and I don't know, what should I do? Or just pick up the phone and make the phone call. Very important. Use the people, and if the HR director, manager don't know, they will find out the answer for us, and they have more contacts than us sometimes in the HR world. And so I rely a lot of information on the HR department for this case, and we just follow the advice and the guideline of the HR department. In this case, if not an officer or owner, we just need to be proactive. Because if not, the other side of the coin is the employee goes home and they say, well, they don't tell me nothing. There is no communication. What to do, what not to do. Should I go to work tomorrow? Should I wait 5 days? Should they're gonna pay me or not gonna pay me? Those questions needs to be answered by the human resources department, the HR that we commonly call it. So that's once you develop policy and procedures, how do you communicate? Well, I mentioned a few examples of ways to communicate to the company, to the people. you don't want to have a company of 100 employees and nobody knows, or just some people in the office knows what to do, but not the superintendent, not the foreman, not the lead man, not the laborers, nobody knows. All start guessing and start create confusion because they don't know. Julio?
Okay, thank you, Luciano. I do have one question is, if someone tests positive, does the company have to tell everyone in the company so that everyone is aware of the situation, or does this break HIPAA rules? Do you have your scenario of how you guys would handle if this were to come up?
Well, the scenario is that, for instance, I've seen a case where the employee gets, for instance, if it's positive, and then we or the company communicated to the foreman, supervisor, and make him aware, and not that, I mean, the person is isolated, again, 14 days or so, and they do the test, and the people or manager have to communicate with the employee almost on a daily basis what's going on. Well, it's very, very, I don't think we need to communicate to the entire 500 people. Some companies have 1,000 people or 1,700 people in cases like that. But again, this is more on the falls on the side of HR. But the minimum superintendent, supervisor, and the people co-workers. So,
And would you recommend, you also need to let, if you're on a job site, let the general contractor know?
yes, makes an investigation or so, and we communicate with the general contractors. Just FYI, this is, we have a tentative case. Let's say the person just gets fever and gets tested and then is negative. Well, in that case, the employee can come back to work and, with a proof that he took the precautions, and then we let him come to work. Let the general contractor or so, that the one employee. Sometimes just because they have the symptoms, we may have allergies or something. 3-4 weeks ago, I was having a lot of bad allergies, sneezing and coughing. It's because of the pollen and all the stuff, but that doesn't mean the person is sick, So that's important to evaluate case by case and make the recommendations in a case by case basis.
Okay. So the best thing to do is make sure that there is a policy or a plan in place from the top down, that from the owner all the way, to the lowest ranking employee, that they're aware of the plan. And then if somebody does become potentially positive or is positive, make sure you let the GC know and let your team know that's on that job. That way you can implement that policy.
Yes, many general contractors will approach a little bit different how to enter the job, for instance. Some people, they check in the temperature, the general contractor check the temperature of the employees, the subcontractors. Other general contractor, for instance, they make you, the subcontractor, check your own people. You bring your own thermometer and you check your own people. And they're on the gate just observing. It just varies from, but yeah, the construction industry is just doing, different ways, but it is enforcing who comes to the job site.
Okay. Manny, did you want to make any comments on that?
Yeah, our situation. So we're the concrete guys. So we're the first as subcontractor at the job site. So a lot of times we're not exposed to the other subcontractors, but depending on, based on the CDC's definition of what they call close proximity, we'll, like Luciano, we'll make an investigation, find out who was within close proximity and how long were they exposed. And then from there, we determine what we need to do and who do we need to communicate to. We do communicate with the GC because we need to make sure the GC knows and is aware, and also explain to them what our action plan was. So So everybody is in the same page with that and understand that we've been following our procedures and process, and we're, if they have any doubts or questions, they could ask us.
Okay. Okay. And with that, I'm gonna introduce you, Manny. And what we'll do is, I know there's some questions coming. We'll hold them to the end and go through them, because I think some of these questions will be answered based on your presentation. So I want to introduce Manny. Manny Rodriguez is also part of our Safety Council and of the National Contract Construction Association Council. And Manny's also been a great help with us. And with that being said, Manny, I'll let you introduce yourself and give your presentation.
Okay. Hey, Julio, thank you for inviting me. And everybody, thank you for calling in. Listening here. Yes, I am Manny Rodriguez with TAS Commercial Concrete. We have close to 1,700 employees, Houston, Dallas, and Central Texas. We have been challenged with this this epidemic here that we've been having at the job sites. But yes, there's some very good questions. But first, let's talk about what the, Julio, can you hit the next slide, please? Let's talk about what the guidance for cleaning and disinfecting. This is something you can find on the CDC line, webpage, and Julio could share this webpage with everybody. Julio said it correctly, and Luciano as well, documentation. Do you have a plan as to determine what needs to be cleaned? Are we talking about everything from a piece of machinery to a piece of a pencil, or a pencil writing, or nail? Are we disinfecting it where everybody is changing equipment, or at the toolbox connect box? So determine how areas will be disinfected. Is that going to be what type of chemicals you're going to use? Or is that going to be water and soap? Or is that going to be hand sanitizer? Consider the resource and equipment needed. So also get a plan if you're going to have a new chemical like we have in our process. We were, because of the shortage, we had to go to different chemicals, and we have a chemical here that has a lot of acid and disinfectant cleaner. It's definitely, when it comes into the point that it was very concentrated, it was a lot dangerous for the person working out there. So we want to make sure you consider all the resources and equipment you have there. Implement. It says clean, visible dirt surface with soap and water. Sometimes we forget that the soap and water is good as disinfectant and hand sanitizer as well. The appropriate for disinfectant product. You could go back to the bleach. There is in the CDC does have how much you could put bleach and vinegar as well. Always follow the directions on the label. That is definitely true. Don't forget that that's the reason they're there. Even though we have this pandemic, that don't mean that we could take shortcuts. So we got to make sure we plan. If you guys that are here listening, you guys are the leaders out there. So each time you're going to give a direction to your supervisors and the people in the field, make sure that we read the chemicals and figure out what they need to do. Make sure that you follow your HASCOM program. And maintain and revise. Continue routine cleaning and disinfecting. That's one of the things that, that will and can help you. When you come to that situation, make sure that all the cleaning you do, that you disinfect it and you maintain it. So like right now, I'm concerned here in my company because in the next couple of weeks, the state of Texas is going to start opening more. Right now, more businesses, so a lot of us are going to get more relaxed. So we got to make sure that we maintain our guys with their high alertness and maintain safe practices. Again, going back to wearing the proper safety glasses, chemical goggles, gloves, the right with clothing as well. So, and also just remember, if however you contaminate yourself here at the job site, you could carry that home as well. And continue practice that reduce the potential for exposure. That social distancing, and I'll tell you a story when we get there, but that 6-foot rule, it works. We've been at a couple projects where the GC has sent us a policy and letters of success stories, because they had other people at the job site that were confirmed positives, and they sent us a letter because of their social distancing and their our disinfectant program. It has worked well. So it does work. So we gotta make sure we maintain everybody at least 6 feet away. And like I made a comment before, it's one of the hardest part is changing a culture. So we have people that are actually eating lunch together because we work together for a long period of time. So what happens? We're used to this. So As soon as we have Julio, Luciano working together, we are sharing the same lunch. We're sharing the same sauce, hot sauce. So that's the kind of stuff. Just remind the team. Okay, this is basically again the guideline from CDC. Julio, can you go to the next slide? Okay, here we have a picture of one of our co-worker at another project in Dallas. They were actually spraying. They bought these 2.5 gallon sprayers, and they were spraying the guardrails. And it's actually a good solution for us because we have heavy equipment. It gives an opportunity to spray our trowel machines, our backhoes, the handles where the Connex boxes as people are going in. They also wash the actual, disinfect the actual handles to the Connex boxes, the offices. So this is one of the systems that works for us. But also when you're doing and you're placing a chemical in the field, please don't forget to get the SDS. Make sure you update your HAZCOM program. Are you putting that on your program in the field, not only in the office, but in the field? Make sure that everybody's trained on how to use it properly. And then after that, do a risk assessment. Well, actually, you need to do a risk assessment first before you get the SDS to know what you need. But part of that is employers need to train each employee on how to use a PPE. Employees must be trained to know at least the following: is the PPE is when it's necessary. What PPE is necessary? So at this point, if you're going to be dealing with the chemical, is this the right glove for this? Is this the right face shield? Is this the right safety glasses that we're going to be using? Also, how to put it on, how to take it off, adjust it, and wear it. Again, going back to the gloves, we bought some gloves here that were kind of small. Our safety manager bought some different ones that fit a little bit better. So we had to make a swap from one medical glove to another. So that's important. And the other thing is also remind your people in the field that they have all this PPE is a last resort. So this is the last sense of defense. So the PPE does have a limitation. Explain to them, hey, after you wear them so many times, after you use them so many times, you have to dispose of them, and how to maintain them properly, and care for them, and how to dispose of them. If it's like whenever you do first aid and CPR or any kind of first aid, what do you do when someone gets hurt? What is the actual proper disposal of the actual the gloves or the face shield or whatever clothing you were using when you were performing first aid? So that's just a little summary of PPE and all this stuff that I picked up right here, and I have bullet points. These are what OSHA's asking while you're there. Julio, we have a next slide, please. And basically go into the whole detail. Make sure you document this, make sure that if you're evaluating doing a safety walk or an inspection and you see that someone is not using the PPE correctly, let's talk about the actual face covers. Are the people using the face covers, although just covering their lip, or they're covering their nose like they're supposed to, like they should be wear? I said, are you going back and retrain them how to use that? Or is that the right protection for them at that point? Or is it the safety glasses are getting fogged up? So what do you do in that situation? So you got to look at all this situation challenges that we are getting at finding at the job sites, and documentation. That is important. Make sure that you document all your training, especially with this COVID-19. That make sure we don't want to make sure nobody gets ill or they transmit the actual virus from one person to another because they didn't wear the proper PPE or they didn't know how to use it correctly. One of the tasks we have here is our safety monitors and safety coordinators are going to the job sites and they're taking temperatures. As they're taking temperatures, they all have their face cover, they have their gloves, they have their safety glasses and face protection. But at the same time, they're asking people to look away from them, and they're taking their temperature with the infrared thermometer. As they're taking the temperature, they're making sure that if they're going to cough, they're going to cough away from them, not at their face. So whenever you have someone doing this type of health monitoring at the job site, teach them, you give them your techniques on what they need to do and how do they need to handle if the situation comes, who to call. And like Julio said from the beginning, make sure that you have all this in writing. Make sure that's part of your protocol on your plan or action plan. Julio, the next one. Okay, action plan for positive confirmed COVID-19. Okay, do y'all have a plan? What is the first situation or scenario? Notification, who do you need to notify? I see some of the questions there that they were asking. Who do you notify? Who do you put everybody in quarantine? Distance, workers' compensation. Do y'all talk about, are y'all gonna pay them? Or are they gonna be at the, if they do come out positive, who's gonna pay them? That was one of the things we talked about in our plan. What is the workplace protocol? And remember, if anybody comes out COVID-19 positive, all this is confidential. So that you cannot be sharing this with anybody else, because I hate to say it, if you just imagine this, if you're the person that came out positive with COVID-19, how is everybody going to look at you? I hate to say that right now we're stereotyping, and everybody do not want to get close to that individual because they have a virus that it could get contagious and it could spread to not only us, but to our families. So you got to make sure that that we have a plan for that as well, that keep that confidential. The last thing, cleaning, make sure you disinfect. That's one of the things that we need to understand, that as soon as you have a situation, a possible, at least in our protocol, that we have to make sure we disinfect. I could tell you a story. We have a couple cases here where some of our coworkers have came out positive, but because of our plan of disinfecting, checking temperatures, and following our protocol, nobody else at the job site was been confirmed positive for COVID-19. But pretty much we had a situation where a coworker was went to go visit his mother-in-law, and whenever he went to go visit the mother-in-law over the weekend, he came to work and notified us that his mother-in-law was in the hospital, that they just called him, and she came out positive for COVID-19. So at that point, he sent himself home. He actually isolated himself and took the measurements he should have, and he did. He stayed home for 14 days, but he was not showing any symptoms at all. He was just in health condition. He was great. Just after he reported to our safety coordinator at the job site, he started losing his taste buds and his smelling sense. So at that point, the guy could have came and work and not said nothing because he needs to work, but he did the right thing. He reported, and we took the right precautionary at that point, but nobody else at the actual project was there transmitted with the actual virus. So the safety manager and myself went out to the job site and spoke with the guys. We didn't have anybody within close proximity, so we didn't have to do nothing else with that situation. We had another situation where the individual, he went to go visit his father on over the weekend, and they told him that his father came out positive. And then whenever he found out, he told us, and he put himself in quarantine. And then after that, same thing, nobody else in his crew, but we were concerned because he had two coworkers that he was working within close proximity, like the way the CDC guidelines says, if you're within 10 to 15 minutes and more, you're pretty much within close proximity for the length time. So we sent them to the clinic to go do a antibody, and they all came out, both of them came out negative, but because they follow the procedure, disinfecting the actual equipment after they used it and touched it, we will avoid to spread that virus here within our organization. And the third one, it was a similar situation. The coworker works for us. The brother lives with them, him and his family. He works for another company. He came to his home. The wife ended up getting COVID positive 19, and our coworker was the same thing, came out COVID-19 positive as well. But all three cases here we had here at the company, they were symptomatic. They didn't have no signs of any kind of flu-like symptoms. Everybody was well. We checked the temperature. The temperature was good. So we're encouraging everybody to cover their face and their mouth, because we got to practice on our coughing etiquettes. That's just another protection for us, because we may look well, but we might be carrying the virus. So it's important that we understand that that's important, and we continue doing that. Julio, next one, and I think that's it for me, right?
Yes. So what we'll do now is We'll try to answer all the questions that have been posted. Just understand that myself, Luciano, and Manny will give you information based on best practices, and to know that Manny and Luciano have different policies at their companies. So I want everybody to understand that if we cannot answer your question, we'll try to get the answer from an expert, especially on the HIPAA rules and laws. So I'm going to start from the top. The question is, if we're at a job site and we have a possible not confirmed exposure from a different crew that was there before us, does that mean we isolate our whole crew or have them self-monitor? Manny, I'll let you go with this one, and then Luciano, if you want to chime in.
If I understand the question right, if they were saying it was a previous crew there before I got there, is that correct, Julio?
Yeah, I'll reread it. If we're at a job site and we have a possible not confirmed exposure from a different crew that was there before us, does that mean we isolate our whole crew or have them self-monitor?
I will ask that individual to ask that question. With these individuals within close proximity of the person that was possible confirmed positive, because at that point, if the person was what they call the close proximity, then you might have a challenge there. If you're not, then you still want to disinfect the area for your coworkers, whether the person comes out positive or not, to make sure that you maintain your crew healthy. And because you still don't want to, even though it may not be a COVID-19, but it could be the flu or some kind of other flu-like symptoms.
Okay, Luciano?
Yeah, I mean, could be like we were saying, and the possible that leaves the door or the window open for, I mean, if it was coughing for other symptoms or allergy. Many people suffer from allergy right now because of the pollen being so high in other in the weather. But I think it's at this time is the question being asked is as a monitor. So I will have in contact with the superintendent or the other people on site and kind of monitor the case by case. Going to be a lot of factors. Maybe the person, again, something related to allergy or coughing or just regular fever, who knows. So the monitoring, the communication between, for instance, us and the other trade should be, is very important at that moment. So go back, I would say communication and monitor.
Okay, thank you. So this next question, I know that the answer to it, the question is, does a company have to pay for employees while in isolation? Does it matter if that person has a confirmed case or not? I would tell you that's going to be more on what the policy is of your company. Luciano?
Yes. Google or check it out, the Department of Labor, DOL.gov, and there is a new act, Families First Coronavirus Response Act, FFCRA, or Act, that says requires certain employers to provide their employees with paid sick leave and expanded family and medical leave for a specified reason related to COVID-19. These provisions will apply from April 1st, 2020 through December 31st, 2020. And then it goes to the paid leave entitlements, who qualifies for like 100% salary for up to 80 hours. And they give you a maximum. And then who qualifies for 2/3 and for different, up to 12 weeks. And they just give you more information. Eligible employees are in the, the information is there. DOL.gov. And the enforcement, whose enforcement did? Well, the U.S. Department of Labor, Wage, and Hour Division. So the person goes to suspect positive or tested for the COVID, At that time, the person we have to pay them. And this is in the act. It says very clear. So Google that one. I encourage everybody to Google www.dol.gov, and that's the act from April 1st to December 31st.
Okay. And again, we also encourage contact your HR department or a professional. Just do a little bit more research, because I know the laws apply differently depending on how big the companies are. For example, the stimulus funds that came out from the SBA were intended for companies, what they consider small businesses, which are 500 and less. So also these Department of Labor laws apply differently to the size of your company. So just the best advice I can give is make sure you ask an expert or research, because it all depends on the size of your company too.
Yeah, double check before you implement something. There are 6 qualifying reasons for leave related to COVID-19, and it specifies in this paper, in this document, which is public, and you just Google that one and you can read it and check it out.
Okay. So the next question, and I know that Manny and Luciano have kind of covered this, but just to reemphasize for anybody that might have came in late, the question is, how do you determine who should get tested or quarantined after a person in a group tests positive? Manny, you want to go first?
Yeah, sure. Again, I would do an investigation, find out what kind of symptom he has, and if the individual been within close proximity of a person that came out positive, and then from there determine how many coworkers have been with this individual. And we also want to make sure you disinfect the areas before you do anything else. And if you have your policy and procedures in place, like we have our process and procedures, part of it is make sure we constantly are disinfecting. So we got to make sure we maintain that.
Okay, thank you. Luciano, do you have anything else to add on to that?
Pretty much, the person, it was in a crew of 3 people, and him and 2 more, or him and 3. I would isolate the other 3 or get them tested and everything, and then we just, again, like Manny said, monitor case by case, and then do a little bit of investigation, and we go from there.
Okay. Next question. How does the supervisor, foreman, owner keep a worker's health status or COVID-19 diagnosis private when the company then has to contact trace that worker's last few days? There's a lack of privacy when you start asking coworkers on the job site how they're feeling and what their temperatures are when worker A is no longer on the job. So the question is, how do you, as you're starting to contact the different people that person came in contact with, or potentially in the last few days, what is a recommendation, or how do you, I know one thing is letting people know beforehand, hey, if somebody comes out positive, we need you to understand this is the policy. But could you guys chime in a little bit more?
Yeah, well, in this case, the designated person, for instance, should, we use the resources of the HR a lot. So I'm kind of reference again with the HR department as far as what to do, what not to do. It's like on any other scenario, we can ask certain questions, even for an interview, for instance, much less related to health, right? So it's a sensitive scenario, but the other point is that you cannot tell everybody, Jimmy Lopez, got positive or everything. This is kind of confidential, but in this case, you have to do the due diligence and go from there. But yeah, that's what I, not to to tell everybody, the entire company, for instance, what's going on in this particular group, for instance.
Okay. Manny?
Well, we did have a similar situation like this. We had a group of 3 guys working together. The individual made our safety coordinator aware that his father came out positive, and he said he was going to quarantine himself, but he said he was going to go do the rapid testing so he could get the results and he could come back to work sooner. So as soon as he went to go do his test, and he felt well, he's a young man, he didn't have any symptoms at all. And he wanted to continue working, so that's why he wanted to get that doubt away from him and continue so he could come back to the project. But whenever he did this his actual testing, he ended up coming out positive. So that situation, the 2 coworkers that worked with them, they were actually quarantined while the weekend came around. On the following week, we sent them to the clinic to go get tested for the rapid testing, and they both came out negative. But we did not mention that to the whole project, but we just say, hey, because of their good practices, they minimize the virus from spreading. The disinfecting, wearing the face covers, the 6-foot distance spacing, and not eating together, that made a big difference for us and limit. It actually limited the exposure to everybody else. But that's our experience here, Julio.
Okay, thank you. So due to time, we're gonna take one more question. This question is, does maintaining records of temperature readings from employees violate HIPAA laws? If so, can we ensure safe environment without violating any privacy laws? So on this, I'll chime in first. Some of the things we've heard from different job sites or contractors, depending on your policy, we've had contractors give us examples where, let's say, they have my name on the list. They'll put Julio, did we check his temperature? And they just check our name off in the morning. They don't put the actual temperature, 99.6 or 95, whatever my temperature was that morning. The thing about the HIPAA laws is how you're keeping that information private. So there's different ways to doing it because everybody does it a little bit different. But the main thing is you want to make sure you are checking those temperatures, and then it's more on how you're keeping that information confidential. Again, Manny and Luciano will give you their point based on their policy, and when they first started out the first day, I'm pretty sure the forms changed or they have to update how they're doing it. Manny, you want to start?
Yes, sir. And I'm going back to Luciano, and I got to give our HR department a lot of credit as well because they've been great partners on this. But one of the things we do keep the temperature log. At first, we did what you just said, Julio. We had the questions that the CDC was requiring, and as things were changing, things were updating, and we were limited on the actual thermometers. When we finally got the thermometers, we actually were able to take temperatures. We keep them, but we document it, and we keep this confidential. As usually the safety or the monitor at the job site taking that information straight to the safety team, and we're actually document that and keeping that as a medical record. Just remember that you cannot share that because treat it like your drug screens. When someone does a drug screen, they come out positive or negative. That's your information, and that's whatever you do with that information at that point. And why am I saying a drug screen? Because we have had situations where a customer will want us to share with us that the temperatures, and our corporate doctor says we can't do that because unless we get their signature and it's okay for them to do that. And we didn't go that route. We just went ahead and sent an email saying, hey, Julio, these are the people that met the pre-screening criteria. And if they have any questions, give us a call. But we did have the information with us.
Okay. Luciano?
Yeah, basically, like Manny was saying, we treat it like a drug test. We don't tell everybody that Julio, for instance, got, was let go because he got positive. So we don't want, and obviously people was going to talk. I mean, we just can't control, the people talk. But what we don't want is leaders of the company spreading the word of who's what, much less people from the HR, Human Resources Department. If it is a case or a tentative case or negative, positive, or whatever, we just treat it, like many are saying, confidential and just as a drug test. When we dismiss an employee because of a drug test scenario, a positive drug test, we just don't announce to the entire company. We just say it's no longer with us, and that's it. It's confidential, and that's it. So yeah, I repeat, people talk, and yeah, we will hear other but not from you, the leader of the company, or safety manager, safety director, HR people, leaders. We can just tell everybody, what's going on.
Okay.
To the doctors, who's coming, what is it, all this stuff.
Okay. Okay. Well, thank you. I'm gonna share some information that was just passed to me before we launched this poll. So if everybody could just bear with me 1 second. I wanted to share. I know that some of us have had trouble finding some disinfectants, or we've been trying to mix things based on the guidance that we see from the CDC and OSHA. But I wanted to share, because sometimes we just need to think a little bit out of the box, and we got this information, and I wanted to share with everybody a flyer we just received. Bear with me 1 second. You can see my screen. We did want to let everybody know that PPG does have a solution to help disinfect. As Manny clearly stated, some of the cases that have came up, it's been really key to have social distancing, and because people have followed the procedures of disinfecting any equipment or tools before they get on to using them, and even after they get off using them. For example, a backhoe or some type of hand tool that gets disinfected, it's helped minimize or eliminate the spread of the virus. So if you want to take a screenshot of this or want more information of this, give us a call, and I'll put our information to the office if you don't already have our information. And just before we wrap up, I'm going to launch one more poll so that everybody can see the poll, and if you can just make sure to answer the questions. It's just 2 questions. Answer them the best that you can, and then we still have a few minutes if you want to put in any questions to the panelists. Okay, we're going to give everybody about 30 more seconds. It's just 2 questions. Did this presentation help you understand a little bit more what HIPAA is? And would you be interested in seeing another webinar or attending another webinar that would go more into depth on the HIPAA rules? And again, I have the PPG product that will, as I mentioned earlier, it's very key to disinfect the tools before and after you use them to help mitigate the spread of the virus. So I'm going to give a few more seconds and we'll share the poll. Okay, so this is the results of the poll. The majority of the people said that yes, this presentation did help them, and they would be interested in getting more information on more in depth on HIPAA. With that being said, I'm gonna put our information here. Here's our website and our phone number, and you can also follow us on social media. If you go to Facebook and Twitter and look up the RHCA by @DFWRHCA, we do put a lot of information there. And if nobody has any more questions, again, I want to thank everybody for logging in. Thank you, Manny, Yolanda, and Luciano for helping to put this together fairly quickly. And just wanted to let everybody know this seminar, this webinar came out of one of our Safety Council committee meetings we had last week. This was one of the topics of concern. We did have 2 yesterday. One of them helped cover how best practices of now that the governor put the executive order to open the state back up and some of us are coming back to the office. Here's our information. Again, I encourage you follow us on social media. And with that, again, thank you to everybody. And if you have any questions, feel free to give us a call. Thank you. And with
Thank
that,
you.
we will end the webinar.